How can you tell whether you have sciatica or a piriformis syndrome? Well, here's the thing. A lot of times patients come in and they've read on the internet and they self-diagnose. They either have sciatica or piriformis syndrome. I'm going to explain to you how I examine patients and what we look for to try to differentiate these two. The first is in the history. Typically, a person with sciatica will have some back pain, but the back pain starts in the back, goes down into the buttock, it goes into the hamstrings, down into the calf, and that's important, and into the toes. Very often they'll have either weakness of their foot or tingling, burning sensations into their foot. Piriformis syndrome typically will have pain on the side of the buttock and maybe down into the hamstring, but piriformis syndrome never goes past the knee. So in the history, those are things that you look for. How do you tell the difference? Well, sciatica typically is a disc problem or a pinching of the nerve that goes down into the feet, whereas piriformis syndrome is where the muscle goes from the sacrum down into the hip, and that can get tight, or in some cases the nerve will actually go through the muscle. Here's a good test that actually we can do in our office and you can actually do at home. It's called a straight leg raise. And what you do is you have the person lie down on their back and raise their leg up in a straight way. And what happens is typically a sciatic patient will have pain that shoots down the leg and goes into their toes. A piriformis syndrome patient will actually sometimes have pain in the butt when you do that, but what you do is when the leg comes up, you turn your foot out. That softens and loosens the piriformis muscle. If the person has pain when the leg goes up and the pain is reduced when you turn the foot out, that's usually a piriformis syndrome. Also, if you actually do this, and I'm going to show you how to do this. If you're lying on your back and you bring your knee up, bring the knee to the opposite shoulder and then bring the foot out that way and rotate, so you would rotate your hip internally. What ends up happening is that very often will cause more pain if it's a piriformis syndrome. It will do nothing if it's sciatica. So that's a good quick way to tell if you have sciatica or piriformis syndrome. If you thought this was informative, give me a thumbs up. Let me know you're watching. If you have any specific questions in regard to sciatica or piriformis syndrome, just leave them in the comment section below. I'd be happy to answer them for you.